7 Things You Must Know About Dental Implants in the UK, 3D Guide. Thinking about dental implants here in the UK? Hold that thought. Before you even consider booking a consultation, you need to hear this. The single biggest mistake most patients make has absolutely nothing to do with the surgery itself. It's about what they weren't told before they started. For too long, the conversation has been all about confusing prices and those tempting offers from abroad. Today, we're pulling back the curtain. Hello and welcome. I'm here to guide you through the truth about dental implants in the UK. And no, this isn't just another dental video. This is a detailed 3D guide designed to give you total clarity and confidence to make one of the most important decisions for your health. We're going to follow the entire journey, from the first scan to the final smile, and reveal the 7 things every single UK patient must know. We'll cut through the jargon, ask the hard questions, and show you what world-class implant treatment in Britain really looks like. Let's get started. Thing 1. The gold standard UK assessment. It's more than just a quick look in your mouth. The first and critical step on any implant journey is the assessment. A proper one is so much more than a quick peek in your mouth. It's where the entire foundation for success is laid. In the UK, the gold standard involves an in-depth consultation and, crucially, advanced 3D imaging, which is almost always a cone beam CT scan. Imagine being able to see right through your jaw. That's exactly what a CT scan lets us do, creating a precise 3D map of your face. With this map, we see 2 things a standard X-ray just can't: the exact amount of bone you have, and more importantly, its quality. This is vital because there's no upper age limit for dental implants. Your suitability is all about your bone quality and overall health, not your date of birth. The scan shows us exactly where the implant must go to be surrounded by dense, healthy bone, while safely avoiding nerves and sinuses. This level of detail isn't negotiable. It's everything. It tells us if you're a straightforward case, or if you might need a helping hand with a procedure like a bone graft. A graft might be needed if a tooth has been missing for a while and the bone has started to shrink. It can add to your treatment cost, but ensures your implant has a rock-solid foundation for life. The initial CT scan itself might cost between £95 and £350, but it is the single best investment you can make. It eliminates all the guesswork and paves the way for a safe, predictable, and successful result. Thing 2. Not all implants are created equal. Materials and brands matter. Once we have our 3D plan, it's time to think about the implant itself. It's easy to assume an implant is just a simple metal screw, but the reality is way more sophisticated. The material, the surface technology, and the brand of that implant play a huge role in its long-term success. The vast majority of implants used across the world are made from medical-grade titanium. It's incredibly strong, durable, and biocompatible, meaning your body doesn't just tolerate it, it accepts it as its own. For patients who want a metal-free option, zirconia implants are also available and look fantastic, but titanium remains the most widely used and researched material. But even with titanium, there are massive differences. Think of it like comparing a basic runaround car to a performance vehicle. Both will get you there, but the engineering, reliability, and longevity are worlds apart. Premium implant systems from world-renowned Swiss brands like Straumann or Nobel Biocare have decades of clinical research behind them. They feature highly engineered surfaces like Straumann's SL Active or Nobel's TI Unite, which are microscopically textured to actively attract bone cells. This clever tech speeds up healing and makes the implant more stable faster. While a premium brand might add a few £100s to the cost, you're paying for decades of research and a proven track record, with success rates often exceeding 95% after 10 years. Going with a lesser-known system without that scientific backing can be a gamble on your future smile. Thing 3. The Cost Explained: Why UK Prices Are What They Are and How to Manage Them. Let's talk about the elephant in the room, the cost. To be direct, a single dental implant in the UK, that's the implant, the connecting part, and the final tooth, will typically cost between £2,000 and £3,500. If you're looking at a full set of fixed teeth using a method like all fours, you can expect to invest between £12,000 and £25,000 per jaw. So why are UK prices at this level? It boils down to three things: regulation, expertise, and quality. Every single dental practice in the UK is regulated by the General Dental Council and the Care Quality Commission, which enforce incredibly high standards for safety and hygiene. Second, placing an implant is a highly skilled surgical procedure that demands years of postgraduate training. You're paying for a surgeon's expertise. And finally, you're paying for the quality materials we've just talked about: premium implants, top-tier UK lab work, and advanced technology all come at a price.
What about the NHS? The simple answer is that dental implants are very rarely available on the NHS. They're generally seen as a cosmetic choice and are typically only provided in exceptional cases, like for patients who have lost teeth to cancer or major facial trauma. For almost everyone else, implants are a private treatment. But the cost doesn't have to be a wall you can't get over. Most reputable UK clinics offer finance plans, often with 0% interest over 12 months, letting you break down the investment into manageable monthly payments. When you think about it, a well-maintained implant can last for decades, which often makes it more cost-effective in the long run than bridges or dentures that may need replacing every 5 to 10 years. Thing 4. The 3D guided surgery advantage: precision, safety, and less pain. This is where that 3D guide concept really comes alive. And honestly, it changes everything for the patient. Remember that detailed 3D scan from your assessment? We use that digital map to create your very own personalized surgical guide. Think of it like a high-tech template that fits perfectly over your gums. It has a tiny, precise channel that dictates the exact angle, position, and depth for the implant placement, all based on the digital plan. This method practically removes the possibility of human error during surgery. The benefits of guided surgery are huge. First, it often allows for a flapless procedure, meaning no need to cut and peel back the gum. The implant is placed through a tiny opening, which means way less pain after the op, less swelling, and much quicker healing. For a single implant, the whole thing can be done in under an hour. This precision also guarantees the implant is in the perfect spot to support the final tooth, giving you a better looking and more functional result for years to come. It takes the procedure from a freehand operation to a meticulously planned process, giving you a level of safety and predictability that just wasn't possible a decade ago. Thing 5. The turkey teeth question: the hidden risks of overseas treatment. You've seen the ads, you've heard the stories. Getting implants abroad for a fraction of the UK cost is definitely tempting, and tens of thousands of Brits travel for it every year. But it's so important to understand the hidden risks that the glossy brochures don't mention. This isn't about criticizing dentists in other countries, it's about understanding the difference in systems. A recent British Dental Association survey revealed a shocking statistic: 86% of UK dentists who had seen patients treated abroad had to treat complications that arose from that work. The risks are real. First, there's regulation. The UK's strict regulatory bodies provide a safety net and a clear complaints process if things go wrong. That level of accountability might not exist elsewhere. Second, there's the issue of materials and paperwork. Patients often return with no implant passport or record of what brand is in their jaw. If a component fails years down the line, a UK dentist may have no way to identify or get parts for it, sometimes forcing them to remove the entire implant. But the biggest risk is the lack of long-term aftercare. A successful implant is a long-term relationship. Having your clinical team just to drive away for checkups or to handle any little issues is priceless. If a problem pops up 18 months after your surgery, flying back to another country is a huge hassle and cost, and many UK dentists are reluctant to fix work they didn't perform. That initial saving can get wiped out fast by the cost of corrective treatment at home, which can run into thousands. Thing 6. The healing process. What to really expect. Once the implant is in place, your body starts an amazing process called osseointegration. This is the magic that makes it all work. It's where your jawbone cells grow directly onto the specially treated surface of the implant, fusing with it and making it a permanent, solid part of you. Think of a tree root growing into the soil. Over time, it becomes incredibly strong and secure. Now, this process isn't instant. It typically takes between 3 to 6 months for osseointegration to be complete. During this time, the implant is usually left to heal peacefully just beneath the gum. In most cases, especially if it's a front tooth, you'll get a temporary tooth, so you never have to walk around with a gap. For those getting a full new smile, patients often leave the very same day with a temporary fixed set of new teeth attached to their new implants. Patience here is the name of the game. It's a vital healing period that absolutely cannot be rushed. Just follow your doctor's advice, keep up your oral hygiene, and make it to your follow-up appointments. This will ensure that when it's time to fit your final permanent tooth, the foundation supporting it is as solid as a rock. Thing 8. The secret to long-term success. It's all about maintenance. This brings us to our final and maybe the most important point. A dental implant is not a fit-and-forget solution. Its incredible lifespan, often lasting more than 20 years, is completely dependent on how well you look after it. While the implant itself can't get a cavity like a tooth, the gum and bone around it can still get sick from plaque. If it's not cleaned properly, you can get an inflammatory condition, similar to gum disease, called peri-implantitis. This can cause the bone holding the implant to shrink away, which can ultimately lead to the implant failing. So the secret to long-term success is simple but non-negotiable: fantastic home care and regular professional maintenance. This means brushing twice a day, using special tools like interdental brushes or a water flosser to clean around the implant, and seeing your hygienist for a professional clean, usually every 6 months. You have to treat your implant even more care than a natural tooth. It's a partnership between you and your dental team. By committing to this, you're protecting your investment and making sure your new smile lasts a lifetime. So there we have it, the 7 critical things every UK patient should know about dental implants. We've covered the importance of a 3D scan, why implant brands matter, what's behind the UK costs, and the incredible benefits of guided surgery. We've also tackled the risks of treatment abroad, demystified the healing process, and revealed that the real secret to a long-lasting smile is in your hands. Armed with this knowledge, you can now move past the headlines and make a smart, confident decision about your health. A successful implant journey isn't just about filling a gap. It's about restoring your confidence, your ability to eat what you love, and your quality of life. If you're ready to see what's possible for you, we invite you to book a free consultation. You can get your own personalized 3D assessment and discover how this technology can help you start your journey to a new smile with total clarity. Thanks for watching.